Welcome back, everyone. My name is David Foy from the HSC Network. This week, we have a sponsored podcast from our partners over at Abbott, an established leader in workplace toxicology and occupational health services. This week, I'm joined by Abbott's Scientific Affairs Manager, Dr. Eva Reichardt. We're going to be looking at the importance of health, safety, and well-being for employees, specifically in the oil and gas industry. Cool, yeah. Brilliant. Well, thank you very much for joining us, Eva. Can you start by maybe giving us an introduction to yourself and how Abbott can help health and safety professionals?
Yeah, of course. First of all, just let me thank you for obviously inviting me and come and speak today. In my role as Scientific Affairs Manager at Abbott, I work with customers all around the globe, and I discuss with them different aspects related to drug and alcohol testing. And that includes anything from the evaluation of new technologies, prevalence of drugs, to, I guess, more practical questions on, how to set up a testing program, things such as, choosing the best sample type for the purpose, determining the need for confirmation testing, and so on. But I guess overall at Abbott, we are committed to provide reliable, innovative, and also value-focused drug and alcohol testing products, as well as services to our customers. We are one of the leading providers of workplace testing programs in the UK, and therefore we are well placed to help companies all the way from the design to the execution of toxicology testing programs. And then in addition, we also help companies manage the health and safety and the well-being of their employees, whether that's, maybe a one-off medical or a complete end-to-end occupational solution. We aim to meet all of the requirements of our customers with our comprehensive services.
So we're mainly going to be looking at oil and gas, the oil and gas industry today. Can you, leading on from that, give us an overview of why health and safety is so important in that industry?
Yeah, I think, it's important to remember that health and safety, of course, is important in every workplace, but particularly in the oil and gas industry. And, that's partly due to its unique setup. It's got remote locations, not just, I'm not just referring to the offshore location, but also, land-based remote locations, which means that, specialists or even, the simplest medical care is usually, difficult to access. And, a small matter, for example, dental care, toothache can become a really big deal when you're in this remote location and you just cannot access a dentist easily. And that might mean you need to be medevaced because of that. And, when you then refer that to acute medical presentations, such as cardiac issues, it can become a much bigger issue. For example, the time it takes for a helicopter to get to site, and then you may want to consider adverse weather conditions, preventing the helicopters from landing on an offshore site. And that all makes it very difficult in this environment. But let me just take a step back, I guess, and go back to, for listeners which may be not so familiar with what the offshore platform work looks like, and let me illustrate that a little bit. In general, workers would remain at a platform for several weeks, and then the work is split into 12-hour shifts. That is long hours of work, physically exhausting work, which, climbing stairways, critical work, going through the walkways and slips, trips, falls, or handling injuries in general are just probably the most common injuries, and they easily happen, but you also have to consider that this work is carried out in extreme conditions, extreme weather, and then due to the nature of work, employees are exposed to smoke, heat, cold. And that's just a few of the factors that, we have to consider when we're talking about the oil and gas sector. Oil and Gas UK, reported that, in 2021, June 2021, there was around 11,000 employees, working offshore at the time, and medevacs are not easy to arrange at the best of times, never mind, adding in, the complexity of sort of a remote land-based location, or, even an offshore site. And therefore, the health and safety provisions are really key, and they need to be rock solid to avoid, or, you're probably, not going to be able to avoid all of the medical incidents, but at least limit them, in that sector. And part of this, and a huge part of this, is achieved by ensuring a healthy workforce. But, there are other aspects as well. Medevacs are incredibly stressful, not just for the employee affected, but for the family, for the colleagues and staff involved in that process. And that's why they need to be as efficient as possible. And you cannot, overlook that they're also exceptionally costly, starting from around 10 to 15,000 pounds, And for all of those factors mentioned, really, employers in the oil and gas sector want to minimize the risk of medevacs at every level.
So why and when are medical assessments being performed?
Well, all staff undergo a medical at the pre-employment stage, so before they are employed by the sector or a company, and then after every 2 years. And really that just aims to anticipate and, where possibly, prevent any avoidable occurrence of ill health, which could place the individual and their colleagues, or even, the emergency rescue services at risk. In other words, the purpose of these medicals is to ensure that, as far as it's possible, chosen personnel and staff are medically fit to work at a remote and the isolated locations I've mentioned before.
So do you have an example for a typical medical assessment and how it can help the employee and the employer?
Yeah, of course. And I think it's, just to put this into perspective, before I start with that, in 2018, which is sort of the latest reported data, medevacs were reportedly requested 241 times. That's a huge number. And the main causes for that are, cardiac issues, acute abdominal pain, and, those injuries I've mentioned beforehand. And that's why it's really important that these medicals are very thorough. And actually, it starts with a very comprehensive questionnaire, right? It covers the entire individual's health history, as well as highlighting any current concerns that this individual may have. And then it's included also physical examinations, and that looks at the key aspects of the cardiovascular system, looking at pulse, blood pressure, BMI, but also include, more standard things such as sight, hearing, and lung function tests. And, coming back to what I said earlier about dental care, in the early 90s, a sizable number of the medevacs were due to dental issues. And as such, occupational health services have now included the dental screen as part of the medical assessment, and that really helped reduce the number of medevacs from remote locations. And that just goes to show how efficient medicals are at, ensuring that you have a healthy workforce. But in general, you can find that employees separate in two separate groups at these medicals. So firstly, you have the young and the fit, for who it is only a tick box exercise, and they sail through the medical. But then this, over time, these same people become an aging workforce, and as we all know, over time, right, your general fitness can decrease, and there's more risks of diseases such as cardiovascular diseases, musculoskeletal, obesity, and diabetes. So the main goal really for the medical exam is just to ensure the fitness for that safety critical work. But even an employee, with a high BMI is likely to be fit for work and would pass in a medical exam. So the occupational health physician may actively encourage the individual at this point then to address that issue, so that there's no further deterioration, to, pass the next medical as well, to be fit for work, but also to ensure the well-being of that particular individual. So is not just about passing the medical, but it's about the wider health promotion and the general well-being of the employee. Then, following the medical, the outcome of the medical is usually a certificate that states you're fit for work. Okay. In the rare cases where medicals are failed, they may be failed completely, or the employee may be restricted. So that means they may only work on certain locations or on certain duties. Abbott's Occupational Health Services also issue specific certificates for emergency team responders. And of course, then there are also medical assessments of survival course trainees' medical fitness to participate, in water training exercises with things such as compressed air emergency breathing apparatus. Our lead physician is Oil and Gas UK registered and trained, and therefore very familiar with the determination of risk for specific medical conditions. And all our nurses are trained in-house to the Oil and Gas UK medical guidelines. And these guidelines really were written specifically with a reference to the UK offshore industry.
So is there anything else that would be done during a medical assessment that you haven't already mentioned?
Yes, the one thing I've not mentioned yet is that routine drug testing can also be performed, and that would be analysis of a urine sample.
So as you mentioned, drug and alcohol testing can be used in medicals. What are some of the common issues of workplace drug and alcohol misuse?
The first thing I want to stress is that the most important issue with drug abuse is really that of health and safety. Drugs and alcohol, both have the ability to impair a person's judgment, and that can delay reactions, and subsequently that could lead to accidents. Out of the medicals that failed in 2018, the most common causes for those failures were cardiac, diabetes, and drug abuse. Okay, and while drug abuse, overall only reports a small percentage of those failures, a large percentage of the medicals failed for those under 40 years of age failed because of a positive drug test. But for an employer, tackling substance abuse, it will really assist with reducing people that are absent from work, boosting morale in the team, and really increasing performance and productivity of your workforce. But I think it's also important to see it from the perspective of the employee, and a successful drug testing program will ensure their health and safety in the workplace. Where drug and alcohol dependence is recognized or, detected by the positive test, employers might provide support for professional services such as drug treatment. And, it's also, I guess, important to remember that, every positive result should be reviewed by a medical review officer. And these medical review officers are independent, right? They protect the employee, and really what they do is they look at whether there's maybe a legitimate reason for positive drug tests, such as medication.
So Eva, when and why has drug and alcohol testing been implemented? Is drug testing only performed pre-employment?
Workplace drug testing is generally implemented as a way of prevention of drugs and alcohol and a reduction of risk to the employee and employer. But it's important to remember that in many ways, oil and gas sector is not alone in tackling workplace drug testing. Many other companies, such as Thames Water, for example, are proactive in ensuring the safety of their employees by implementing drug and alcohol testing in their workplace. As you already mentioned, pre-employment testing is common as recruiting. The wrong person it's a costly exercise. So using testing as part of that selection process or during the probation period helps really mitigate personal related risks. Additionally, employers may choose to do random drug testing during their employment, which allows businesses really to test their employees at regular intervals with a fair testing process. And and test their personnel randomly. But also, for-cause testing is key following an accident or incident where maybe there's evidence or suspicion of drinking or drug abuse. And then finally, in some events where previous drug abuse may have been detected, employees may choose to do a sort of back to work monitoring in order to help support an employee returning with previous substance misuse issues.
So what are other considerations for employers looking to support their employees' health, particularly those working offshore?
As I've mentioned before, the main causes for medical issues are things such as cardiac issues, obesity, diabetes, etc. But it's also important to consider the employee's mental health. Oil and gas companies need to provide the best medical care for their remote workers as possible, not only to avoid incidences, but also to retain their workforce. Working remotely is extremely stressful, both for the body and for the mind. And whilst nowadays remote locations often have gyms, options for exercise are limited in that setting. So, taking that into account and being away from family and friends, this has got the ability to cause mental health issues. I guess the more a company can do to help the worker stay healthy, the better it is for the employee satisfaction. And, at times it's an easy things like remote health counseling, which helps the worker stay healthy.
Absolutely. Well, Eva, we've covered some fantastic ground there. Where can people go to learn more about this subject?
To learn more about the subject, you can visit our Abbott toxicology website and learn more about that.
Brilliant. Thank you very much, Eva.
Thank you so much, David.